Hello everyone, once again welcome to my OET channel. Today I came with another one informative video regarding OET speaking. I have a card that is the exam card on 6 April 2024. So this is regarding the role play card. We are talking to a patient that is a baby's mother regarding influenza vaccination, but the baby is affected with the type 1 diabetes. So I will show you the card as well as I will explain you how you have to present your card effectively to get base cover. So let us start. And the first of all, what we have to do during the 3 months preparation time, we have to see the setting. So there is a clinic that is very much important, and now we have to you have to imagine that you are sitting in a clinic. All right, you are speaking with a concerned mother of a 9-year-old child with type 1 diabetes. So you have to imagine that you are sitting on a chair in front of a baby's mother. You have to prepare yourself that you are talking to someone with what condition or what's the relationship, everything. Then only the flow of the talk will come naturally. And the baby is affected with the type 1 diabetes mellitus, and you are explaining regarding influenza vaccine. The patient's doctor has recommended the flu vaccination for their child, but the mother is worried about the potential side effects and effectiveness of the vaccine. So this is what you are going to explain. So now you came to know that what is the purpose of the visit and to whom you are talking regarding what you are talking. These many things that you have to be in your mind during your 3 minutes preparation time. Next, what you have to do, you have to think whether you need to ask you need to ask the mother's name or the baby's name. It is a clinic and this is the first time she's approaching you, and it is not a known case as well, because they didn't give that you have already examined or you already have started the conversation. So it is just like a normal scenario that the mother will come to you and you will start a conversation. All right, the first task is find out the reason for mother's visit. So it is so totally clear that it is unknown case. So this is a way how you have to find out whether it is a known scenario or it is a unknown scenario. So many of the students used to get difficulty to find out whether it is a known or unknown. So nothing but you can just see that whether they have started a conversation or it is the first time. The first task is find out the reason for mother's visit. So how we can start, you have to keep it in your mind you are talking to a mother. So reassurance is most important thing. So just you can start like this. Good morning, my name is Reshmi and I am the register nurse working in this clinic. How may I address you and how can I help you today? So within a single sentence you can stop that task. And the answer will be, good morning, my name is Maria and I came here for my 9 years old son. My son's GP advised him to take influenza vaccine, but he has already type 1 diabetes, so I'm so much concerned. So that will be the answer for the first task. So the second one, whenever you hear something concern, what you have to do, you have to give the reassurance. So you can tell that, oh my dear, I'm really sorry to know about your baby's condition, but no need to worry, I'm here to explain you in detail regarding the influenza vaccination. Okay, so that's enough. And the second task is, then what you have to do, you have to put a tick mark on the left side of the task, which is very much important. You will not miss any task. Outline risk associated with the type 1 diabetes, child with influenza, like weakened immune system, vulnerable to influenza. And you can just ask, example, you don't know regarding the concern, what is exact concern. So maybe you can ask, Maria, may I know what is exactly concerning you or bothering you regarding the vaccine? Then the answer will be, yes, sister, actually, I'm somewhat concerned about the potential side effects and effectiveness of the vaccine as well. So it's just clear that mother has both concern. So what you are explaining that, oh Maria, I will explain you in detail. I can tell you that the risk associated with the type 1 diabetes child with influenza, because I'm really sorry to tell you that your baby, since your baby has child 1 diabetes, his immune system is weakened and he is very vulnerable to get the influenza. But no need to worry. If your baby receive this vaccination, of course he can get rid of from the infection. Whenever if you will tell something complication, you have to use this frame. Okay, I'm really sorry to tell you, then you can just inform, but no need to worry. Then you have to tell the positive side of the sentence. All right. Then Stress the importance of influenza vaccination with the son's condition like virus constantly changes and severe condition like pneumonia even require hospitalization, and discuss the effectiveness and safety of the vaccine as well. So how we can stress, so always you have to concentrate on the task, what is your exact task, that is a stress, that means you have to explain. So next you can tell that, Maria, I would like to tell you the importance of influenza vaccination for your son's condition because this virus, the influenza, constantly changes over a time period like yearly. Severe, sometimes the severe flu condition can cause like pneumonia, even pneumonia, and require hospitalization as well, and that's why I'm strongly suggesting you to get your baby for the vaccination. Moreover, I would like to explain you something regarding the effectiveness and safety of the vaccine. It will fortify your son's immune system and reduce the complications of flu, as I mentioned earlier, such as pneumonia. Are you getting my point? Like that you can inform. And another one more thing, everyone used to forget to include a patient or relatives in your conversation. It will be just like a paper reading or a newspaper, like a news reading, that you will keep on talking to the patient or the interlocutor, and the interlocutor will give you only the answer like yes or no. But what you have to do in between, you have to ask, do you have any concern, do you want me to explain anything more, are you following my explanations, you still look anxious, is there anything to be explained, so something like that you can use in between. You can ask here as well, still you look anxious, Maria, is there anything still bothering you? So the answer, the question, I mean the answer will be, um, they are concerning about the safety profile. So you can tell, I mean the parents may ask that, sister, I can truly understand your concerns, but what is bothering me is I'm just thinking about the safety of my son, because already his immune system is weak, and if he's getting strong, like the vaccine, so what will be his safety? So you can tell that, as a mother, I can truly understand your concern, Maria. I will explain you in detail the safety profile of the influenza vaccine. I can tell you that after the research and testing of millions of people, they found out that they found the only mild side effects such as soreness at the site, low grade fever, or something like that. It is very mild and minimal side effects will be there after influenza, and it will be carefully formulated as well for each and every age group. And I can tell you that if your baby have any side effects after the vaccination, it can be managed clearly with the over-the-counter medication such as paracetamol. Is that okay for you? So that will be the answer. And next you can ask, do you have any more concern, or you can tell that for your further information I would like to explain you regarding the administration of influenza vaccination. Is that all right, or may I proceed with that? Don't use the term shall or can, maximum try to avoid can. Instead you can use may. It's like a polite word, okay? And you can tell that it is a single visit appointment. Pre and post blood sugar checkup will be there, so no need to worry about your baby's blood sugar, which will not affect it because of the influenza vaccination. As I told you, if there is any side effects, you can manage with the over-the-counter medications. And I would like to tell you that rarely if symptom worsen. If it's happened, please contact with your baby's GP as early as possible. But I can tell you that most probably it will not happen. Are you getting my point? Is it clear for you? Something like that you can ask. And you can ask at the start, at the end, you can ask, Maria, I hope I have clarified all your doubts. Is there anything still worrying you? Or do you need any more clarifications? So the ending will be always like that. So the mother's answer will be, no sister, I got complete information. It's that okay, fine. Then the last task is encourage the mother to book appointment for vaccination. So we can tell that, Maria, I came to know that you have received all the informations, and I would like to give you one pamphlet or leaflet in which the complete information regarding the flu vaccination have given, as well as which included, as well as I would like to tell you that is included what is the effect of influenza vaccination if anyone affected with any chronic illness, especially like type 1 diabetes mellitus or hypertension or kidney diseases, pregnancy, childhood, everything. So it will be useful for you to get more information. Then another one more thing it is there. So are you okay to book an appointment for your son's flu vaccination? Okay, so that's the last task. Then the mother's answer will be yes, of course you can do that. Then you can tell that thank you so much, Maria, for agreeing with me. And I am once again reassuring you that nothing is there to be worried about your baby's condition after the flu vaccination. He will get adequate or effective immunity against the flu. Have a nice day. So like that we can end ours. We can tell, okay, if you don't have any other concern, may I proceed with your baby's payment. So that's enough. So this is a simple role play card and it's a clinic scenario. So there are some content, but of course within 5 minutes you can finish it off because there are no more subtasks. I hope this is a first role play card and you can make it like a very fast because there are no more explanations. It's like repeatedly more or less same contents out there. So you can refer these cards and talk with your friends as well. Okay, set a time for 3 minutes and set time for 5 minutes for your presentation and let you see how you can produce effectively. If you are talking to your mother, of course, in the starting and ending, there should be reassurance. Don't expect that you will get every information from the card. Some informations you have to use yourself, same like a pamphlet and reassurance. Don't talk something out of cards except reassurance and this informational leaflets. So it will be a waste of time because you have time period. It's only 5 minutes and they will not give even 1 second also. So this is the explanation of the card. I hope this card is beneficial for you. Try to talk with your friends or your study mates with this type of cards and it will be beneficial for you. And always you can refer the cards of 2021. 2022 because there will be repeated cards in 2024 from those years, and if you want to have the access, it's there in my YouTube channel, or you can access to my Telegram group or in the WhatsApp group. Everywhere I used to keep on post these all PDF, all that means all recent exam role play cards from 2021 to 2024, which are all the things I have. So it will be easy access. If it is in the Telegram, you can go to the file section and you can see the PDF sections of speaking cards, and you can have a printout and study always. So it's my kind advice that whatever the module, you should have a printout. I know that in some countries it will be very difficult to take the printout, but even though it is beneficial if you have the printout, if you are studying especially for speaking, because there are massive changes if you are doing in the mobile, and if you are doing it the paper, you can underline, you can put some, like you can put the tick marks wherever you finished, and you can just write the patient's and the parent's name over there, and at the end of the discussion what are things you have to sum up, you can just mention it during the 3 minutes preparation time. So if you are doing with your mobile, there is no use of 3 minutes preparation time, nothing, you could not make mark anything and you will not get any benefit from 3 minutes preparation times. Okay, so don't stuck on all the type of cards as well. Always try to keep your recent exam cards for the practice. There is no use of practicing with the old types of cards and very small cards as well. So just choose the recent exam cards and make benefit. Okay, and thank you for watching, and I would like to give some more information regarding my pro guide regarding the writing and speaking. I have with the recent exam questions. The guide contains like 100 recent exam questions and sample letters with basic Oet letter writing and Oet grammar. Speaking, I have 100 recent exam questions with the explanations as well as the USB. There is attached USB. You can see the videos of the explanations and basic videos of speaking as well. And there is one small online academy I have started with a few tutors. They all are expert in teaching, especially reading and listening, because I am not concentrating on these two modules. And if there are any students, if you feel you need some assistance for all these modules or any of these modules, you can have access. The contact number is given in the description and you can have the access, and we will give you the complete information. It is completely online and 1:1 attention. There is no Zoom classes or there is no Zoom lecture coachings. Everything it is like 1:1. Tutors we will allow to you, the tutors according to your area where you reside. Example, if you are in Middle East, it is very difficult to arrange the schedule if the tutor is in India or somewhere. So we used to prefer the area where you reside, and we used to allot the tutors so that the time will not be, or the time zone will not affect your schedule according to your time, especially if you are working and if you have family and if you don't have enough time with the 12 hours duty schedule. So it is easy, you can set the time with your tutor and you can utilize. Okay, so if you have any concern, you can just WhatsApp and we are ready to give you the answers. Okay, I hope this section is benefit for you, and we will see you with another one informative video. Until then, bye. Take care.